As students here at Pecan, we are responsible for keeping the herb room clean when we are assigned the herb room duty and when we're occupying the space making formulas. The patients can see through the glass door, so we always want to keep everything looking clean and organized. When students use formulas, they should replace the bottles in an organized manner so they are lined up on the shelf. After making the formula, the grinder, mortar, and all the work surfaces and equipment should be in the same state they were initially. Items should also be returned to their proper place after use. When handling raw herbs, either making a formula or restocking herb jars, the student should use plastic gloves. If we are out of any supplies, notify the clinic office or write a note on the whiteboard. If you need help with formulas or cleaning up, you can always ask the student on herb duty for help. If you need to make a formula, it should be completed 30 minutes before the end of the shift, and no formulas should be started within 30 minutes of closing. If there is an intern that is starting a formula within 20 minutes at the end of the shift, it is time management that needs to be addressed. We should always give enough time for the herb room attendant to clean the dispensary for the next shift. If there is a shift that doesn't have an assigned herb room duty person, all observers, assistants, associate interns, and interns are responsible for the herb room and resetting it for the next shift. You always start off by returning any granule mixing jars, trays, and any other herb room equipment from the ECR station that the previous shifts left to dry. You are in charge of assisting any students or supervisors in filling formulas. Make sure to ask if anyone needs help. 30 minutes before the end of the shift, clean granule mixing jars and trays in the ECR, set on the drying racks, and leave for the next shift. At some point during the shift, clean the assigned raw herb shelf by removing everything on the shelf, wiping down the shelf using the spray cleaner and paper towels, and then returning the jars to the shelf. Make sure that all the work surfaces have been wiped down and are free of debris, including the grinder, mortar, granule mixing tables, and raw herb prep table. Make sure all items are put back where they belong. Finally, we have the supervisor on the shelf inspect the herb room and sign off on the herb room clean checklist at the end of the shift.
Students must stop by the clinic office window and sign in to use the herb room if they're not currently on clinic shift. Hand the office worker your herb sheet that's been signed off by the supervisor. They'll keep the white copy to ring you up and put that in your file, and the yellow copy will be yours to take home for your own records. If the formula is for a friend or family member, the clinic office will shred the white copy with your request. It's best to have a supervisor sign off and you fill your formula if you're on your shift if possible. If not, try to come in during times where there'll be less traffic in the herb room, such as the beginning of the shift. If you sign at the office to make a formula and you don't have an herb sheet assigned, the clinic worker will inform a supervisor and they'll come out and fill to the waiting room at their first convenience. Students who are not on shift are not allowed to enter the conference room. It is a supervisor's job to guide the interns who are seeing patients and not to diagnose students who don't have appointments. Also, when signing off on the herb cleaning list, there'll be a clipboard with the signing sheet. Make sure you have the right week, your shift. You sign off as a student which shelves you cleaned, and also take it back then for the supervisor to come out and inspect and also sign off when they're done. Thank you very much for your time.